To determine the rate of DNA synthesis in various mammalian tissues, the administration of which of the following labeled substances would be most specific in labeling DNA? A. Adenosine. B. Cytosine. C. Guanosine. An oophorectomized monkey is treated with high doses of estrogen. Which of the following changes is most likely to occur in the endometrium after 1 year of treatment? A. Atrophy. B. Hyperplasia. C. Hypertrophy. A physician wishes to determine the proportion of newborns delivered at a local hospital who had a diagnosis of congenital heart disease within the past year. Which of the following statistical measurements best describes these data? A. Attributable risk. B. Incidence. C. Odds ratio. An investigator is studying normal sleep patterns in healthy volunteers. Saccadic motions of the eyes are seen approximately 90 minutes after the subjects fall asleep. Which of the following is most likely to be observed in the subjects during this period of saccadic eye movements? A. Difficulty awakening. B. An EEG pattern resembling that of the waking state. Drug X applied to a nerve axon decreases the duration of the action potential without affecting the resting potential or peak amplitude of the action potential. Which of the following is the most likely mechanism of action of drug X? A. Increase in the rate of voltage-dependent changes in K+ permeability. B. Decrease in the rate of Na+ inactivation. A 45-year-old man has a progressively severe headache. Fundoscopic examination discloses blurred margins and bulging of the optic discs. The retinal veins are engorged and show no pulsatile flow. Which of the following is the mechanism most likely to explain these findings? A. Increased intracranial pressure. B. Demyelination of the optic nerve. A 53-year-old woman dies 4 days after an automobile collision. She sustained multiple injuries including a femoral fracture. Widespread petechiae are found in the cerebral white matter at autopsy. Which of the following is the most likely cause of these findings? A. Fat embolization. B. Contrecoup injury. A new drug is developed that prevents the demyelination occurring in the progress of multiple sclerosis. The drug protects the cells responsible for the synthesis and maintenance of myelin in the central nervous system. These cells are most likely which of the following? A. Astrocyte. B. Oligodendrocyte. "10 years ago, a 60-year-old woman underwent an aortic valve replacement with a porcine heterograft. She now has shortness of breath with exertion. Examination and X-ray of the chest show evidence of congestive heart failure. Which of the following is the most likely explanation for these findings? A. Degeneration of the valve. B. Development of mitral stenosis. "2 hours after undergoing a right hepatic lobectomy, a 59-year-old woman has a distended abdomen. Her pulse is 120 minutes and her blood pressure is 160 millimeters of mercury. Which of the following is the most likely cause of these findings? A. Poor mechanical hemostasis. B. deficiency of factor 7. C. Deficiency of factor 12. A 70-year-old man is admitted to the hospital for elective coronary artery bypass grafting. On the day of his operation, an asymptomatic carotid bruit is found. Which of the following is the most appropriate immediate next step in diagnosis? A. Duplex scan of the neck. B. CT scan of the head. "10 days after admission to the hospital because of acute pancreatitis, a 56-year-old man with alcoholism develops chills and temperatures to 39.4 degrees Celsius 103 degrees Fahrenheit. Examination shows a tender abdomen with hypoactive bowel sounds. Which of the following is the most likely diagnosis? A. Pancreatic abscess. B. Pancreatic insufficiency. Which of the following post-translational modifications is most likely to be found on a cyclin B protein that is targeted for degradation? A. Ubiquitinated lysine residues. B. Phosphorylated serine residues. C. Phosphorylated threonine residues. The release of epinephrine from the chromaffin granules of the adrenal medulla into the bloodstream in response to neural stimulation is mediated by which of the following? A. Acetylcholine. B. Gamma-aminobutyric acid, GABA. C. Cortisol. Native collagen is composed almost entirely of which of the following types of structures? A. Alpha helix. B. Beta pleated sheet. C. Random coils. D. Triple helix. A 15-year-old girl limits her diet to carrots, tomatoes, green vegetables, bread, pasta, rice, and skim milk. She has an increased risk for vitamin A deficiency because its absorption requires the presence of which of the following? A. Triglyceride. B. Intrinsic factor. C. Phosphatidylcholine. An increased concentration of fructose 2,6-bisphosphate in hepatocytes will have a positive regulatory effect on which of the following? A. Gluconeogenesis and glucose 6-phosphatase. B. Gluconeogenesis and phosphoenolpyruvate carboxykinase. C. Glycolysis and phosphofructokinase 1. During the processing of particular N-linked glycoproteins, residues of mannose 6-phosphate are generated. Which of the following proteins is most likely to undergo this step in processing? A. ApoB receptor. B. Lysosomal alpha-fucosidase. Which of the following is required to transport fatty acids across the inner mitochondrial membrane? A. Acyl carrier protein. B. Albumin. C. Carnitine. D. Chylomicrons. Failure to bind LDL to its receptor results in uncontrolled synthesis of cholesterol. This occurs because synthesis of which of the following enzymes is not repressed? A. Acyl-CoA cholesterol acyltransferase. B. 3-hydroxy-3-methylglutaryl HMG CoA reductase. C. Lecithin cholesterol acyltransferase. Skin scrapings have been collected from the advancing edge of a ring-like lesion on the arm of a child. Which of the following observations is diagnostic of dermatophyte infection in a direct KOH preparation? A. Septate hyphae. B. Chlamydoconidia. C. Macroconidia. A teenage boy has developed a tender, painful, lump in his axilla. The lesion eventually came to a point and drained purulent material. A gram stain of the pus revealed WBCs and gram-plus cocci. Which of the following would be the most probable source of this infection? A. Resident microbiota. B. Food. An immigrant from Bolivia complains of abdominal pain and cramping. 2 months prior he passed numerous bloody stools. On examination, he has right upper quadrant pain and hepatomegaly. If this is a liver abscess, which of the following might have caused it? A. Ascaris. B. Entamoeba. Which one of the following is an important virulence factor of Bacillus anthracis? A. Protective antigen. B. Lipopolysaccharide. C. Pili. D. A toxin that inhibits peptide chain elongation factor EF2. MHC class I molecules are critically important in what immunologic process? A. IgE-mediated histamine release. B. Phagocytosis. C. Immunoglobulin class switching. D. CCD8 plus T-cell cytotoxicity. An unculturable gram-positive microorganism has been visualized in tissue specimens obtained from patients with a previously undescribed disease. Which of the following techniques would be most useful in identifying this organism? A. Serology. B. PCR amplification and sequencing of rRNA genes. C. Multilocus VNTR analysis. Resident flora is commonly found in the A. Liver. B. Urethra. C. Kidney. D. Salivary glands. The patient presents to the emergency department with non-bloody diarrhea for 12 hours. The patient lives in the Washington area and has not recently traveled out of the area. Which one of the following is unlikely to be the cause of your patient's diarrhea? A. V. Cholerae. B. C. Jejuni. An investigator experiments on Clostridium perfringens and then sterilizes the culture dishes by autoclaving. This method of sterilization is most appropriate because it ensures that which of the following bacterial structures are inactivated? A. Spores. B. Endotoxins. The pathologist uses monoclonal antibodies against several intermediate filament proteins and finds that a tumor section stains positive for cytokeratin only. The tumor most likely originated from which of the following tissues? A. Connective. B. Epithelial. C. Glial. A polysome is actively involved in translation. The ribosomes are attached to which of the following? A. Single-stranded DNA. B. Double-stranded DNA. C. mRNA. D. rRNA. During an experimental study, an investigator develops a new member of the class of non-nucleoside reverse transcriptase inhibitors. This new drug most likely inhibits HIV infection through which of the following mechanisms? A. Binding to reverse transcriptase. B. Binding to RNase H. C. Blockade of integration. A 6-year-old boy has a large intra-abdominal mass in the midline just above the symphysis pubis. During an operation, a cystic mass is found attached to the umbilicus and the apex of the bladder. Which of the following is the most likely diagnosis? A. Urachal cyst. B. Meckel cyst. A 66-year-old man with Zollinger-Ellison syndrome undergoes a gastrectomy. He is informed that he will require treatment with intramuscular vitamin B12, cyanocobalamin, for the rest of his life. This therapy is necessary because this patient lacks which of the following types of cells? A. Parietal. B. G. Gastrin. In which of the following nuclear structures is DNA actively transcribed to rRNA? A. Envelope. B. Lamina. C. Matrix. D. Nucleolus. A 10-year-old boy undergoes an appendectomy. Granulation tissue develops normally at the incision site. Tissue remodeling begins at this site with the degradation of collagen in the extracellular matrix by which of the following proteins? A. Metalloproteinase. B. Lipoxygenases. Which of the following muscle cell components helps spread the depolarization of the muscle cell membranes throughout the interior of muscle cells? A. Actin. B. Myosin. C. T-tubule. During a study of bladder function, a healthy 20-year-old man drinks 1 L of water and delays urination for 30 minutes after feeling the urge to urinate. Which of the following muscles permits his voluntary control of micturition? A. Coccygeus. B. Detrusor. C. External urethral sphincter. A 60-year-old man has tenderness in the region distally between the tendons of the extensor pollicis longus and extensor pollicis brevis, anatomical snuff box, after falling on the palm of his right hand. A fracture of which of the following carpal bones is most likely in this patient? A. Hamate. B. Scaphoid. A 70-year-old man has a 90% blockage at the origin of the inferior mesenteric artery. He does not have intestinal angina. Which of the following arteries is the most likely additional source of blood to the descending colon? A. Left gastroepiploic. B. Middle colic. C. Sigmoid. A 3629G, 8 pounds, male newborn is delivered at term. During the initial examination, urine is found to be leaking from the umbilicus. This patient most likely has an abnormality of which of the following fetal structures? A. Umbilical arteries. B. Umbilical vein. C. Urachus. A 3-year-old girl with mild craniofacial dysmorphosis has profound hearing deficits. Further evaluation indicates profound sensory auditory deficits and vestibular problems. Altered development of which of the following is most likely to account for these observations? A. Ectodermal placode. B. Neural crest cell. An investigator is studying heart development in an experimental animal model. The animal model is genetically modified so that no cardiac neural crest cells develop. This animal model is most likely to have which of the following cardiac abnormalities? A. Persistent truncus arteriosus. B. Coarctation of the aorta. A 78-year-old woman undergoes an outpatient laparoscopic cholecystectomy. During the procedure, ligation of the cystic artery is planned. It is most appropriate to ligate this artery at its junction with which of the following arteries? A. Gastroduodenal. B. Right hepatic. C. Left hepatic.